You are very welcome to this update on the UK and Europe. Now, there's no question that, whatever you want to call it, let's call it a second wave. We're into a second wave in the UK and in Europe. And things are going to potentially get quite a bit worse over the next month or two because we've got this winter to get through. So let's start off and look at the UK and see what's going on and see if we can identify some of the factors that are going on and some of the things we need to do about it. And some of the things are completely obvious, of course. As the weather gets colder, we close the doors, we have less ventilation, there's more of us in a small room. The disease is spread by droplets and aerosolization. We're not wearing masks universally. We're not socially distancing universally. We're not practicing hand hygiene universally. All of these things are obvious, but what else can we identify? So let's look at the situation here. Now, these are the cases in the United Kingdom. Now, the direction of late is not good. The potential for this kind of rise is there if measures are not taken. So the past 24 hours in the UK, as of yesterday, Thursday, that was 18,980 new cases, giving that many officially diagnosed cases by proper antigen studies of the virus. But no doubt we've got a significant increase in cases. Basically, that's September, that's the 1st of September. So we had a gradual increase in August. And then this is the nature of exponential rise. The numbers increase greatly. So what's going to happen here is less certain. But unfortunately, we are seeing an increase in deaths as well already, but we'll come on to that. Now, the COVID symptom tracker app, so that's the official number of diagnosed new cases according to the antigen studies. The COVID symptom tracker app gives an increase of pretty well 30,000 new cases in the day. And if anything, the COVID symptom tracker app underestimates because it doesn't pick up the 20% that are asymptomatic. So no question, we've got dramatic increase in the UK at the moment. Active cases according to the COVID symptom tracker app, 363,000 active cases. Now, deaths up 138 in the last 24 hours, giving rise to 43,000. This 43,000 number is the number of people who have died within 28 days, regardless of the cause, within 28 days of having a positive test. This higher number, the 57,000 odd number, is the number where COVID-19 or SARS coronavirus 2 is mentioned on the death certificate. So this number is higher. So this probably more accurately represents the real number because, of course, not everyone who died was diagnosed. Many, especially in the early stages, died without being diagnosed. Now, hospitalisations. Let's just go and look at this is direct live feed from the government site here on hospitalisations. So this is purely for COVID patients. Another 792 patients, making a total of 150,000 altogether. But patients in hospital at the moment, 4,941. Patients on ventilation, 563. Just look at that data there. So this one is patients admitted to hospital, 24-hour periods. So we see it's, can we get it there? Well, we see the 7-day average is 681. The average for the past 7 days on this graph. So things were good here. This was the bad days here, but there's no doubt that this line is increasing. And they're the figures given as regards to that graphic. That's for the UK as a whole. Patients in hospital for the UK as a whole, 4,124. The average for the last 7 days, 4,239. But there's no question about the direction of that line. Patients on mechanical ventilation or intensive care, 477, but again we see the increase. Now we know for sure that these numbers are going to carry on increasing. There's no question about that, because, to use this appalling expression, the increase is baked in because of the increase in cases, and we know now that a higher proportion of these cases are in the older demographic. Back in summer it was mostly the younger demographic, less hospitalisations, but because of the people already in this graph here for the increased cases that are older, this is going to transpose through into more hospital admissions over the next weeks or month, and that will transpose into more deaths. That is inevitable. It's baked into these numbers. Now, moving from tier 1, more places are moving from tier 1 medium to tier 2 higher. So places are moving up from tier 1, the lower tier, the medium risk, to tier 2, the higher risk. This gives a ban on household mixing indoors, including pubs and restaurants. Do check out the news sites. The UK news sites go into this in detail. But moving up to tier 2, as of tomorrow, London, Essex, York, North East Derbyshire, Chesterfield, Erewash, Elmbridge, Barrow in Furness, down in the bottom left-hand corner of Cumbria, where they make the submarines. So all of those moving up. Now, there's a big argument raising in the UK about Manchester at the moment. We'll maybe come on to that later, but there's a completely undignified row going on, and it's basically all about money. Manchester perhaps needs to go up into tier 3. Well, it does need to go up into tier 3, but the local authorities there, the potentates there, are arguing against that. And it's become a rather undignified scrap about money, really. How people there are going to be supported, if they're going to be supported. Politics has long been in this pandemic in the United States, of course, and it is becoming more and more politicised in the UK. Anyway, let's stick to the facts, which is what we try and do on this channel. Professor Jeremy Farrar of the Wellcome Trust, in fact, is a big boss in the Wellcome Trust, is the chairman, or whatever you call the head of the Wellcome Trust. Best controlled countries. There's a national consensus about the way forward. And I believe the professor here is strongly intimating that this is what we do not have in the UK. Now, if you don't live in the UK, the background here is that we used to be a United Kingdom, but there's been a balkanisation really in the UK. We've got separate governments in Scotland, Wales. There's an assembly in Northern Ireland. Sometimes it's sitting, sometimes it's not. When they can agree, it's sitting. But power has also been dished out to local potentates like Andy Burnham, the Mayor of Manchester, and Sadiq Khan, the Mayor of London. And these people have a lot of power. So it's no longer one government that's in charge. Everyone kind of fights about it. So let me just, without becoming political, because that's not what we're trying to do on this video at all. We try and explain science. But let me just ask you the question. Is this contributing towards the national consensus about the way forward? Which happens in the best controlled countries? Patently not. Is this pandemic showing up weaknesses in infrastructure, in organisations, in political infrastructure, all around the world? Patently it is. But talking about people not moving together, unbelievably, there was 100 guests at a wedding in London. Now, you're allowed 15, so that's 85 too many. Now, I don't know, I haven't interviewed all those guests, but I would imagine most of them knew they were breaking the law. You know, if people aren't going to obey the law, we have anarchy. I've experienced anarchy abroad, and it's terrifying. And it's worse when there's a few guns about, of course. But even in the UK, you know, it's people are prepared to completely flout the law. It doesn't matter whether you agree with it or not. We either have law and order or we have anarchy. And this has just shown up the weakness in well, we know that people have weaknesses, but normally they are regulated. So anyway, this was broken up by the police. Southwest London, flagrant and arrogant violation of the law, according to the officers. Arrogant is a good word there. There was clearly no attempt by the venue owners to enforce the regulations or keep their patrons safe, but of course the patrons know what the law is just the same as anyone else, you would imagine, and yet they were collaborating in this illegality. And we've seen so many super spreader events that we've reported on many times. Now, just to illustrate a bit more of the disorder in the UK, the Scottish government, from Monday, advocating masks for workplace, canteens, corridors and community facilities. Completely 100% agree with the intervention. But the point is there's a different rule for England, different rule for Scotland, different rule for Northern Ireland, different rule for Wales. Add to that these local potentates who can exert quite a lot of authority and restrict what national government does, and the situation becomes difficult to fully comprehend. I don't think anyone watching this video is on top of the regulations everywhere in the UK at the moment. I know I'm not. They change quickly and they're different everywhere. It's not an ideal situation. We are not fulfilling the professor's criteria. We are simply not fulfilling. If we want to be a best controlled country, we need a national consensus about the way forward, and I've given that one across already. We don't have it. So, is that showing up weaknesses in the UK? Yes, very much so. Northern Ireland, pubs, restaurants, hair, beauty salons closed for 4 weeks. Unfortunately, that's become necessary. Again, the intervention makes sense. People suffer because of it, but the intervention just kind of makes sense. But again, it's a bit different everywhere else. Wales is trying to close off, basically. Wales are saying no travel to or from Northern Ireland. So you can't go from Wales to Northern Ireland or Northern Ireland to Wales. Anywhere in England with a Tier 2 or Tier 3 restriction. And Scotland's central belt. Now, the central belt of Scotland, if you're not in the UK, is that bit literally like a belt across Scotland. It's kind of, it's got Glasgow and Greenock and Glasgow on one side, then Bathgate and places like that in the middle. Then Edinburgh on the right-hand side, Edinburgh on the east coast, and it kind of forms a populated belt across the middle of the country. But in a lot of cases there, they do have additional regulations. And now you can't go from Wales to the central belt or from the central belt to Wales. We have this travel restriction, and there does seem to be some enforcement there. Now, this has worked. I'm thinking of the example of Western Australia, where this has worked dramatically well. Basically, the Premier of Western Australia said you can't go in or out of Western Australia. If you do come in, you need to quarantine for the full 14 days. It's got to be supervised. It was supervised, and the cases in Western Australia remain remarkably low. But I don't think the Welsh Government are proposing such restrictions on travel, so I fear it won't be as effective as it was in Western Australia. Indeed, as it is in Western Australia. Yeah, probably won't work that well. Right, let's look at some of the European figures now, moving on to Europe. Well, daily new confirmed COVID-19 cases. France, the United Kingdom, Spain's levelled off a bit, which is good. Netherlands increasing, Italy, Germany increasing as well, unfortunately. But if we look at this per capita, we see that Germany is doing fairly well. Italy was doing very well, unfortunately increasing. The trajectory is not looking good in Italy. Spain more levelled off, the UK going up, France going up, and the Netherlands, dearie, dearie me. The Netherlands not doing well at all, given the relatively low population of the country. They are searing ahead in a race that we do not want people to be searing ahead in. So what we said about Europe, what we said about the UK is basically true with these increasing trajectories. Now, Ursula von der Leyen is self-isolating, presumably for the full 10 to 14 days. Boss of the European Union, not quite sure what official title is now. President or something. President of the European Union, I think. Anyway, she's isolated, but presumably, like Kamala Harris, she can work effectively remotely. Now, France, as we've seen, not good. That was the increase on Thursday. That was the increase on Wednesday. So 30,000 new cases on Thursday. The total, obviously many of these were diagnosed back in the first wave, what we're now calling the first wave. But this increase, this kind of number is a big increase. Now Paris, Marseille, Lyon, and many other French cities, that they're just a few, they're starting a curfew. 8 other major centres in France, I don't know them all. But the curfew, which is enforced for the next 4 weeks, and the curfew will be from 9 o'clock in the evening till 6 o'clock in the morning. So that's going to restrict nightlife in France quite significantly. But President Macron seems to think that is an effective way to reduce the specific infection drivers. The alcohol and the socialisation together in France have been identified as a way that the disease is being transmitted. So everyone has to be at home at 9 o'clock. I guess they can still take a bottle of wine and drink it at home, but then they're not mixing with other households. That seems to be the targeted strategy as identified by French epidemiologists, now legally enforced in France. President Macron aims to reduce the daily rise to 3,000 cases. So he needs to reduce it by a factor of 10. It's 30,000 now. He wants it down to 3,000. That is going to take quite a lot of intervening. Now, this was interesting. Police raided homes of senior government and health officials, investigating their handling of the pandemic. Now, if the police are raiding homes of senior government officials and senior health officials, to me, if the police are involved, this indicates there's been illegal activity. I don't know, but has this shown up a major weakness in the hierarchical organisation of France? Well, if there's police raids on senior government officials and health officials, I don't think that's something we can exclude. So again, weakness is being shown in the system here. I was really quite surprised to read that. Actual police involvement there. So, yeah, okay. Now, Switzerland did really quite well in the first wave. We hardly talked about it at all, but now cases in Switzerland are going the other way, unfortunately, and increasing. Population only 8.5 million. Situation, this is according to the Premier in Switzerland, I can't remember his or her name, but they say it's deteriorating at an alarming rate. Cases increasing in Switzerland, 2,600. Remember, the population is only 8.5 million. But the point is, it is increasing. The direction of travel is not good. It's the highest daily number since the start of the pandemic of new cases. That's the highest number since the start of the pandemic, even in what we call the first wave. Deaths in Switzerland have accumulated now to 1,817. But proportion of positive tests were 5.4% last week. Now, I know that's not as high as in the United States, but it indicates a lot of community transmission. But now that's more than, well, it's nearly doubled. So last week it was 5.4, now it's 10.2. This indicates there is a lot of community transmission in Switzerland, therefore the number of cases will increase. It's almost baked in, to use that expression. Oh, here's the president here. I'm not familiar with Swiss government, I'm afraid, but the president, not even going to try and pronounce that, warned of a full-blown second wave was looming. And given that number of positivity rates, clearly he is correct. Switzerland, the numbers will increase, and we can say this, they will increase over the next month or so because of the high positivity rate in testing. Now, Italy, just remind ourselves, there's Italy down here. New daily confirmed cases per million people. So it's still lowish, but the direction's going up. And we did a video of why Italy was doing so well. But unfortunately, it's now got 8,800 new cases per day. 83 more deaths in the day. Hospitalisations, another 310. 586 of whom are in intensive care unit, intensive therapy unit. And the capacity for ITU, of course, was a big problem in Italy in the first wave. Government, any further restrictions would be targeted. So they don't seem to be going for a national lockdown, but more targeted approach. And actually, this is probably a good principle. Rather than shutting down Manchester or London or New York, there's particular suburbs in New York, for example, that have high numbers of cases. In fact, there's particular blocks in New York, particular buildings that have a high number of cases. And this is the same in any city. So maybe we need a much more targeted lockdown than the citywide lockdown we have at the moment, because it's much more regionalised. There's particular clusters in particular parts of cities, whereas other parts can be fine. Maybe that's part of the way ahead, a more targeted, localised lockdown than we have now. That seems to be what the Italian authorities are thinking about. And epidemiologically, that does make a lot of sense, a much more precise targeting. So you could have a situation where someone was fairly locked down in one area and a few blocks away that they might not be because of a particular cluster in a particular area. It's not a ludicrous approach by any means. Czech Republic, low population, fastest rate of infection increase in Europe, another 9,500 cases in the day. This is the number of increases just in October. Population 10.7 million. So the fastest rate of increase in Europe at the moment. In the Czech Republic, the country, of course, that was part of Czechoslovakia in the Soviet era. Hospitalisations in Czech have also doubled since the 4th of October. 2,678, 535 in ITU. And their capacity is limited, so they made agreements with the adjacent German states of Bavaria and Saxony that they can transport some of their ITU patients into Germany if that becomes required. So Europe increasing as the United States. So as I've just mentioned in the previous video of the United States, we are heading into what is really the main danger part of this pandemic. We got through the first wave. We need to get through this second wave. But the risks over the next few months are significant as cases are increasing. As I said about the United States, this time next year will be better. But we've got this winter to get through first, and it's going to be a difficult time. Right, on that note, sorry to leave you on that. Let's leave on something positive. Next spring and summer, this time next year, it's going to be massively better. Okay, thank you for watching as always.